As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community. And welcome to Your Health with Terrebonne General Medical Center. I'm Martin False, and our guest tonight is Dr. Ruthanne Gallagher, and she's a pediatrician with Bayou Pediatrics. And this month, or this week, is National Infant Immunization Week. So I guess the first thing, well, welcome aboard, first of all. Doc, how have you been?
Hi, nice to be here.
Good to see you. What is National Infant Immunization Week? Can you give us a little profile on it?
Well, during the last week in April, hundreds of communities across the United States joined with communities in over 100 countries across the world in celebrating the role immunizations have played in the health of our children, communities, and our public health, as well as highlighting the importance of immunizations.
Okay. Now, why does an infant, or anybody watching, why would their infant need to be immunized?
Well, babies will get some temporary immunity from their mother during the last weeks of their pregnancy, but this is only to diseases that the mother has immunity to, and also doesn't last very long. So infants are especially vulnerable to infectious diseases early on. Vaccine preventable diseases are still present in the United States as well as to a greater extent across the world, so that it is important to maintain immunity through vaccination. Many parents don't realize their children's vulnerability to these potential dangerous diseases because of the success of immunization. The babies who are born in the United States, and that's 12,000 a day, need to be immunized against 14 vaccine preventable diseases during the first 2 years of life.
That's an important question, and you hear it a lot. Are vaccines effective?
Yes. Immunization is one of the best ways that parents can protect their children against serious infectious diseases. Again, because of their success in immunizations, a lot of parents don't realize that they are at risk for these illnesses. An example is measles. In the 1950s, almost every child got measles, and many children died from measles. Doctors coming out of medical school now have probably never seen a case of measles, and hopefully they won't. Although because of a lapse in vaccine, there have been a few outbreaks of measles in the United States in the last few years in communities where there's a high rate of non-vaccinated children.
Immunizations, are they safe to get?
Immunizations are extremely safe. The vaccines have been thoroughly tested before they're released for the public, and there's ongoing monitoring by doctors, researchers, and by public health officials. There are always some degree of potential side effects to any vaccine as well as any medication, but the number of serious side effects is very small.
Now, like, I know when you do certain procedures or they give you a dye, that there might be a reaction. Are there any typical reactions that you would get to an immunization?
The typical reaction is most patients will experience some pain, swelling, and discomfort at the injection site. Other than that, the reactions kind of vary according to the immunization as well as the person. Again, there is always a risk of, for instance, a severe allergic reaction. So if you've had a vaccine and you have any sign of a severe reaction, you do need to contact a physician immediately.
All right, what we're going to do, we're going to take a break. We have a lot of important information yet to bring you on this segment, including you'll be able to see it right off the screen. So when we come back, Dr. Ruthanne will tell you a little bit more about all of this important medical information. We'll be right back.
My PhD is in chemistry, so I've spent a lot of time doing research in the lab. I work for Albemarle Corporation. My name is Arcelio Malcolm, and I was treated for prostate cancer at Mary Bird Perkins. I went to Houston for a second opinion, and they recommended the same treatment plan, so I chose to be near my family and have the treatment done here. When you research the technology and the doctors, you see that Mary Bird Perkins is a perfect choice.
Mary Bird Perkins Cancer Center at TGMC.
with the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
And welcome back to Your Health with Terrebonne General. Dr. Ruthanne Gallagher is our guest tonight. We're talking about immunization week, and I think we left off with vaccine preventable diseases. What are they? Which ones are they?
Okay, well, there are several. So I think we have
We're going to put them on
a
the
list
screen.
somewhere.
There you go.
Okay, the first one we talk about is diphtheria. This is a bacterial infection. It's transmitted person to person through close physical and respiratory contact. It causes infections of the nose and throat, which can lead to breathing difficulties and even death. And you see that children need to receive 3 doses by 6 months, a booster dose between 15 to 18 months, another booster between 4 and 6 years, and another booster between 11 to 12 years. And this is the D in the DPT vaccine.
Okay, all right. And we have another one?
The next one is the HIB or Hib vaccine. Hib is another bacterial infection that's present in the nose and throat. It's transmitted through sneezing, coughing. Infected children can carry the Hib without showing any signs of illness, but they can infect others. Before the vaccine was instituted in the late 1980s, this was the most common cause of meningitis, pneumonia, and other serious infections in children. The risk is highest between children 6 months and 2 years. Again, they receive a dose at 2 months, 4 months, 6 months, and a booster between 12 and 15 months old.
Okay, and then you have hepatitis A.
Hepatitis A is a liver disease that can be serious. It's caused by a virus, the hepatitis A virus. The virus is found in the stool of persons who have the disease. It's spread by close contact and by eating and drinking contaminated food or water. It is a 2-shot series administered at least 6 months apart. Currently, it is recommended to be given between 12 and 23 months of age, the two series.
Okay, then we move to hepatitis B.
Hepatitis B is another viral infection that affects the liver. Most infants pick up hepatitis B at birth. If they are infected at birth by a mother who is carrying the virus in her blood, they usually become chronic carriers. They can carry the virus for many years and can spread it to others. It's spread usually by contact with blood. It is a 3-dose series. The first dose is recommended to be given shortly after birth in the hospital. The second dose, 1 to 2 months. The third dose at 6 to 18 months old. This shot can be given at any time, so a lot of adults may get it, especially if they're going to be entering into a healthcare profession or going to a healthcare facility.
Okay, very good. Next one we have up would be measles.
Measles. This is a highly contagious disease. This is the first M in MMR. It's spread by droplets from the nose or throat of infected persons. It's very communicable. It's probably the best known and the most deadly of all the childhood illnesses causing rash and fever. It's the first vaccine is given between 12 and 15 months. The second dose, or kind of a booster dose, is given between 4 to 6 months. Again, this is in with the MMR.
Okay, and then
meningitis. Now, this is the meningococcal meningitis. It is another bacterial infection. Meningitis is an infection of the brain and spinal cord. The transmission is from person to person through airborne droplets from the nose and throat. It can be fatal very rapidly if contracted. Right now, the first dose is given at age 11 to 12 with a booster shot at age 16.
Okay, and mumps?
Mumps, this is the second M of the MMR. This is a virus, again, that affects primarily the salivary glands. It usually affects children between age 5 and 9, spread by droplets released when a person coughs or sneezes, or by direct contact. The first dose is given in the MMR at 12 to 15 months, the second dose between 4 to 6 years.
All right, and then pertussis, also known as whooping cough.
Pertussis or whooping cough. This is a bacterial disease that affects the respiratory tract. Children who contract the disease will have coughing spells that last for 4 to 8 weeks. It's most dangerous in infants. It spreads easily from child to child, and as you get older, you will lose your immunity, so adults have what we call a reservoir of infection for children. The first dose should be given at 2 months, again, the 4 months, 6 months. This is the P in the DPT. a booster dose at 15 to 18 months, another dose before they go to school, 4 to 6, and then another booster shot between 11 and 12 years.
Okay, then we have pneumococcal, which is PCV.
Right, this is the pneumococcal or the Prevnar vaccine. The pneumococcal is a bacteria. It causes serious blood infections, pneumonia, and meningitis, mostly in young children. It is given the first dose at 2 months, the second at 4 months, the third dose at 6 months, and a fourth, a booster dose between 12 to 15 months. There is a new form of this that's just been released that is more effective in replacing the old form. So some infants are getting a fifth dose to
Okay.
give them an advantage of the new improved vaccine.
Very good. Then we move on to poliomyelitis, which is also known as polio.
Polio. Polio is a crippling disease. It is caused by a virus. It is spread from contaminated food or water, contaminated with feces. It multiplies in the intestine, enters the bloodstream, and can invade certain types of nerve cells, which can damage or destroy. It spreads easily in areas with poor hygiene. Polio was almost eradicated worldwide, but it is starting to try to make a comeback, so the polio vaccine is still important. The first dose is at 2 months, the second at 4 months, the third dose at 4 to 6 years old with their preschool shots.
Okay, and now we'll move on to the rotavirus.
The rotavirus. This is an oral vaccine. Rotavirus is the most common cause of severe diarrheal disease in infants and young children globally. Children under 5, especially those between 6 months and 2, are most vulnerable. It's most often seen in severe cases in low-income countries in Africa and Asia. However, we do get seasonal outbreaks in the U.S. yearly. The vaccine is given, as I said, orally, the first dose at 2 months, second dose at 4 months, a third dose at 6 months. You do not start the series if the baby is already over 12 weeks old, and the final dose has to be given by age 32 weeks.
Okay, and we move
32 weeks.
Okay, and we move on, Dr. Rubella and CRS.
Okay, rubella and CRS. CRS is congenital rubella syndrome. Rubella is actually a fairly minor viral illness when adults get it. When a woman who is infected with the rubella virus early in her pregnancy, though, she has a 90% chance of passing the virus to her fetus in 5 to 7 days. This can cause the death of the fetus or congenital rubella syndrome. Congenital rubella syndrome can lead to deafness, other defects of the eyes, heart, and brain. It is spread in airborne droplets through sneezing or coughing, and it is given, it's part of the MMR. This is the R of the MMR vaccine. The first dose from 12 to 15 months, and the second dose at age 4 to 6.
Now, one I remember quite well because I stepped on a nail as a kid would be tetanus.
Okay, that's right, tetanus. Tetanus is not transmitted from person to person. It is caused by a bacteria that usually lives in soil, and a person becomes infected when dirt enters a wound, usually in a deep puncture wound caused by dirty nails, knives, tools, wood splinters, sometimes animal bites. This is the T in the DPT vaccine. First dose at 2 months, second dose at 4 months, third dose at 6 months, the fourth dose between 15 to 18 months, a fifth dose between 4 and 6 years, and then after that, it is recommended that you get a booster dose of tetanus every 7 to 10 years.
Okay, and last but not least, the famous chicken pox.
Right, varicella or chickenpox. This is an extremely contagious airborne disease. It is spread through coughing and sneezing and can even be spread through the air in AC vents. So
Wow.
you could go through a whole room or hospital ward. It usually starts with a skin rash, sometimes high fevers, and it may become itchy, blistery pox, which mostly heal without scarring. But those of us who've had chicken pox can usually find one little pox that's scarred. Its first dose is given at 12 to 15 months, the second dose at 4 to 6 years.
Do they still put all the kids in the room and let them all catch it at one time?
Not anymore because we have the vaccine.
All right, there you go. That's a good answer there because I remember hearing that. Never could figure it out, but I heard
Well,
it.
that was because it was almost universal to get it, and you wanted your child to get it before they got beyond kindergarten because they would miss. If you get chickenpox, you were out of school for a whole week,
Right, okay.
at
well,
least a week. So
very good. Now, if they're interested in immunizing their infant,
They should call their physician, or they can call TGMC at 985-873-4141.
Dr. Ruthanne, thank you so much for coming on tonight. And that's a lot of immunizations, but very thorough, and thank you for bringing that to light today.
Thank you.
All right, we're going to take a break. When we come back, we're going to go in the Kanata's kitchen, and we're going to see what they're cooking up, so don't go away.